Another week of injuries that could affect your NFL team or maybe your fantasy team. Welcome to That's Gotta Hurt. I'm Dr. David Geier. Let's start this week talking about J.J. Watt. News that came out last night has been sort of emphasized and run through the media this morning. That is that J.J. Watt, the defensive end for the Houston Texans, will be placed on injured reserve. Now, he had surgery in the offseason for a herniated disc in his back, and that was also after having surgery to repair core muscles. So overcoming a lot this offseason. Has played in all 3 games for the Texans this season, but according to reports, may have re-injured his back Thursday night against the New England Patriots. The Patriots won that game 27-0, and now basically the media reports are saying that J.J. Watt has injured his back again. He's going to be placed on injured reserve, which means he could potentially come back around week 8. But according to insiders with the team that have spoken to ESPN, the Texans are not optimistic about that. Now, what we don't know here is, did he basically just restrain the muscles around it, maybe come back too soon, or does he have a recurrence of a herniated disc? That is certainly possible after that surgery, and sometimes you can have a second operation, a second discectomy to remove the new part that's basically extruded and pressing on the nerve root. We're going to learn a lot in the coming weeks. Hopefully it's just an aggravation of the muscles and it's not a second surgery. Once those back issues start to build up, look at Tiger Woods, that can become a really tricky problem. Now let's talk about Seattle Seahawks quarterback Russell Wilson. This is an update from what we talked about last week on this show. Now, if you heard a giant whooshing sound in the last few days, that was the entire city of Seattle exhaling when they got the good news. Russell Wilson did not tear his ACL. According to head coach Pete Carroll, he only injured his MCL. And he expects Russell Wilson to start this week, to not miss any games for this. And Russell Wilson hasn't missed a single start in his entire career, so that would be tremendous news. We talked a couple days ago about what an MCL injury would mean in terms of a brace and getting that ligament to heal. Wilson has flown his personal physical therapist up to Seattle to work with him. Apparently they're doing things around the clock, including waking him up at night for treatments. I think there's a real good chance, just watching Wilson overcome a lot of minor aches and pains, overcoming the ankle sprain earlier this season, I actually do think he'll be back to play. We'll see as practices go on, but my question would be, even in a knee brace that he wears to play, can he cut side to side? Can he basically plant his foot and change directions? I think you may see him, if he plays, be more of a drop back passer, but compared to what this could have been, definitely good news. 2 other quarterbacks, New England Patriots quarterbacks, Jimmy Garoppolo and Jacoby Brissett. We talked about Garoppolo last week. He had the AC joint injury. That's the small joint on top of the shoulder after he got his shoulder driven into the ground. That's not typically an injury that needs any kind of surgery, but it's really painful. Plus, being on his throwing shoulder, that can make throwing difficult. This is a time thing, this is a treatment, and you see basically when his pain gets better and when he can do what he needs to be able to do on the field. His backup for the game against the Houston Texans last week, rookie Jacoby Brissett, in that 27-0 win, injured the thumb ligament at the base of his thumb during that game. Initially, it was expected that he actually might need surgery. There are reports now that suggest he won't need surgery. He was seen, like Garoppolo, at practice yesterday, but basically it was hard to know what he could or could not do. The problem with that ligament at the base of the thumb is grip strength. It's not just pain, but is it stable enough to basically grip the ball well and throw? So these are both injuries that potentially you could play, but it could be really tricky being as good as you need to be. They don't have Tom Brady for one more week, so there's going to be a lot of eyes on Patriots practice in the next couple days to see if either of those guys are ready. And we'll finish today with an injury from Major League Baseball. Another New York Mets pitcher, this time Steven Matz, has decided he's going to have surgery that will end his season. He's having surgery done at the hospital for special surgery. They're going to basically remove bone spurs from his elbow, and typically that's right off the tip of the elbow near the inside of the elbow. It's good news in the sense he doesn't need Tommy John surgery, but it's still a surgery that takes time to recover. By just shaving out some bone spurs and not having to repair a structure like a ligament, the recovery is a lot faster. They're saying about 12 weeks, and that seems about right. right. You do have to watch those injuries in the long term though, because when you remove bone spurs from the tip of your elbow, there is more stress that goes to that ulnar collateral ligament. So you do see occasionally Major League Baseball pitchers ultimately have Tommy John surgery months or even a year or two after surgery to remove bone spurs because of that increased stress. This is terrible news for the Mets as they head into possibly making the playoffs. They had already lost Matt Harvey. He had a rib removed to treat thoracic outlet syndrome. Basically, you had Jacob DeGrom that we talked about last week, had surgery basically to treat a problem with his ulnar nerve. You have Zach Wheeler that's struggling to recover from Tommy John surgery. Jonathan Neese, issues with a meniscus tear. Terrible, terrible news in terms of health of their pitchers. This one shouldn't be real bad news in the long run, but obviously bad news for right now as they hopefully head to the playoffs. Okay, that's going to wrap up our This Week in Injuries segment. A lot to get to. Remember, as always, if you have athletes that you want me to discuss and you want me to discuss their injuries, leave those in the comments below this video and I'll try to answer those in an upcoming This Week in Injuries segment on That's Gotta Hurt with Dr. David Geier. If you like this show, you like what we talk about, definitely subscribe to my video channel. Click a link in the upper right corner of this page. You'll get these episodes delivered directly to you. Watch tomorrow. We've got something a little more fun and lighthearted for you. Thank you so much for watching. I look forward to seeing you right here next time.